We have an individual here with us tonight who will share their personal cancer journey this evening, and it's a friend to many in this room. You've seen her up here on the podium before, and she's integrally involved in this event here tonight. So please join me in welcoming to the podium once again Teresa Kitson. Teresa?
Thank you. And I'm also going to have my friend and co-chair and breast cancer survivor, Terri Baldi, come and kind of be a little support for me. My husband asked me, are you going to cry when you give your speech? And I said, no, I'm a tough cookie. I don't feel like a tough cookie right now. So Terri will be here to kind of help me. All right. My breast cancer journey started in the summer of 2009 when I discovered blood in my bra. Because I'd always been extremely healthy, my attitude had always been wait and watch, and things always cleared up. This did not clear up. So after 3 days, I knew I needed a mammogram. I went and had a mammogram at the Susan Komen Breast Cancer Center, which is down on 91, very convenient. And they also gave me an ultrasound, and then the radiologist doing my ultrasound said, you also need a biopsy. That was scheduled a few days later. And to my surprise, just a few days after the biopsy, we learned that I did have breast cancer. After that, we met with the treatment team of all the possible surgeons who may be, depending on what my treatment was and depending what stage I was, they talked about radiology, chemotherapy, lumpectomies, bilateral mastectomies, and they gave us all the ranges. In order to find out what stage I was, I had to have a PET scan. I had the PET scan, and then shortly after that, we met with my oncologist, Dr. Lee Linquister, and she told me I had cancer. And she said it was stage 4 cancer, which means it spread, and it spread to my bones and a lot of my bones. I think I lit up that PET scan like a Christmas tree. And I asked her, should I do anything? You know, if it is stage 4, it's terminal, because we had been, when we met with the surgeons and oncologists, the doctors had talked about survival rates for stage 1, stage 2, stage 3, and kind of at the end, it was like, we really don't have rates on stage 4 cancer patients because there just aren't that many of them. Not that many of them make it to 5 years. So when I heard it was stage 4, I asked Dr. Lee Linquister, should I bother to do anything? It sounds pretty grim to me, and she said, yes, you have to try. You have to try because we don't know how the medicine's going to react, and we have to give it a try. So I did. And then she said, you can start chemo tomorrow, which was a Friday. And in the 5.5 years I've known her, that was the only time I ever said no to Dr. Lee Linquister. I told her I need the weekend to recoup. I promise I'll be here Monday morning, and we'll start. At that point, I had 10 sessions of chemotherapy. I also had a bilateral mastectomy. And you lose all your hair, of course, and you have some side effects, but I was very fortunate. My side effects were very minimal. Some days I just felt like I had a bit of a flu, very achy, very fatigued. And then, you know, your hair's gone and that's it. You don't have to worry about that anymore. And I'm happy to say I also asked Dr. Lee Linquister at that first meeting about approximate what's my life expectancy. And she said about 3 years. Well, I'm happy to say that was 5.5 years ago. So thank you. I know a lot of people are happy to be here tonight, but none happier than myself and my husband, so thank you very much. It's amazing. It's amazing how God puts the right people into your life just when you need them most. After my hair started falling out, I felt the need to move beyond my marigold ball caps. And any woman who's had breast cancer has probably had a marigold ball cap. And so I did. I went to TJ Maxx because I thought at some point in the winter I'm going to need different hats and probably a wig. And I was at TJ Maxx and I was talking about, you know, what kind of winter hats you're going to be getting in. And I looked up and this woman was staring at me. And I kind of glanced at her, I looked away, and I looked again, and she's still kind of staring at me. And you feel a little vulnerable. And in my mind, I thought, yes, I have cancer, please go away. Well, the next thing I know, this woman has pulled her cart up next to mine. And it's like, total stranger in TJ Maxx, what's going on? But I looked at her, and I thought, oh, she's got really cute sandals, and she's got a purse almost identical to mine. She must be okay. So she introduced herself as Terri Baldi, a breast cancer survivor, and she told me that in the brief conversation we had, she told me she would come to my house and teach me how to wear scarves, because she wore many scarves after she lost her hair. We discovered we're both named Teresa. We both had breast cancer in the right breast. We're Irish Catholic. We had the exact same treatment team at Illinois Cancer Care Center. And we have very understanding husbands, so we had kind of an immediate bond. After I met her, I went out to my car and I cried, because all along I had been kind of a stiff upper lip. Like, I can get through this. I don't need to talk about it. I don't want to talk about it with everybody. I'd rather keep it very private. But when I met Terri and I went out to my car, I felt, okay, I'm better. And I've always believed that I had a guardian angel, but I didn't meet her until that day in TJ Maxx. So Terri and I have been, we traveled this together. You too. So Terri and I, of course, over the years, we've known each other 5.5 years, and over the years you get to know each other a little more. So aside from all of our positive traits and things we have in common, we've also discovered we're both kind of bossy and kind of stubborn. But we've also decided that's a good trait to have if you have cancer, because you need to kind of have that grit, and so we're okay with that. We're okay with that. All right. Others who have also helped me through this journey is my neighbor, Dr. Gavish Patel. He told me that, he said, when he heard my diagnosis, he said, Teresa, you got to put up your fists and you got to fight. And I was like, no, it's either the chemo works or it doesn't. I'm really powerless. And he said, no, you got to fight. And eventually my attitude changed, and I thought, well, I can't just sit here on my couch in the family room waiting to die. So I did fight. Because my chemo was very mild, I was able to do things. And I could, take care of my house, take care of my dogs, go out to dinner, do different things. So I decided, oh yeah, we're not going to sit here and wait to die. We're going to get back out there and do something. We also had a huge help from another friend, Catherine Spitznagel, who is here tonight, also a breast cancer survivor and works at Caterpillar. And she was a huge support to my husband, because my husband really needed to talk about it, and I really didn't. I preferred not to talk about it in detail. So Catherine also knew what I was going through, but she also knew what a spouse goes through. And so I felt very relieved that Tim now had a buddy at work that he could confide in. And Catherine soon adopted me too, and would send me cards, flowers, whatever. And she does this for a lot of people at Caterpillar who either have cancer or the family member has cancer. She's kind of an ad hoc committee of support. I finished my chemotherapy, and on May 10th, 2010, I was declared no evidence of disease, which meant I was clean, in remission. And that lasted until April of 2011. And since that time, I've been on some various treatments, no more IV chemo, just pills, which is very easy to do. And so I've kind of got ongoing treatment. And with Dr. Lee Lindquister, when one drug stops working, she switches me to something else. And I always say, should I be worried? And she says no. And I would ask her, are you worried? She would say no. So I trust her. I trust her with my life. And she obviously, I wouldn't be here tonight if it wasn't for Dr. Lee Lindquister. There are also many people who've helped me during my journey, but none more than the staff at Illinois Cancer Care. From Todd Collins in imaging, because I'm a little claustrophobic and I have to have PET scans. He's very patient with me, extremely patient. Marty Williamson in the laboratory. She draws my blood. I have a port which they insert under your skin, and it makes it easier. They just stick a needle in, and they can draw blood. They can give you medication. And it's very simple, and she's so patient with me. And I started out having to use numbing cream one day. I forgot. And I said, let me run home and get it. And she said, no, we don't have time. She said, you can do this. And I said, okay. And she said, take a big breath, and I did. And she stuck the needle in my port, and I've never used numbing cream since. She's so skillful. Also, Jason Harlow at the pharmacy, and also the nurses in B-Pod. I know a lot of the nurses in B-Pod because I've been there a lot, especially this summer. My potassium has been up and down, so I spend a lot of time there with the nurses in B-Pod. They're very, very helpful, very warm. They bring you warm blankets. On Friday, there's a woman who comes and brings homemade cookies. We have pet therapy dogs come. They bring you warm cocoa or lemonade, whatever you want. It's a beautiful treatment room. You don't feel like you're in a hospital or clinic at all. You have the beautiful glass windows, and you look out onto the pond and everything. So the treatment rooms are very comfortable and pleasant. You're in a very comfortable, almost lazy boy chair. The funny thing is that when I was diagnosed, we had only lived here 2 years, and many of my family and friends said, oh, you've got to come back to Nashville. We lived in Nashville for 17 years. And you've got to go to Vanderbilt for treatment. And if you don't go to Vanderbilt, then at least go to Chicago or Northwestern. Because they said, Peoria is too small a city. You won't be able to get the excellent care that a big city has. And boy, were they wrong. They had my best interests in heart, but they didn't know the medical staff we have here and the opportunities. And, you know, and some of them have come to visit. I brought them to the cancer center when I had my mastectomy. My one friend, Kathy Kunkel from Nashville, she met the surgeons and she said, wow, Teresa, you are so lucky. And I said, I know. And extra lucky for me, I live 5 minutes from the cancer center. So if I'm not feeling well or something, I can just pop down there, and they're very warm and opening and just very helpful. And again, it's so convenient. It's a beautiful facility. Oh, sorry. Okay. Thank you, Terry. Illinois CancerCare is known for exceptional treatment and research, but my gratitude toward the physicians and staff brought me to become acquainted with the foundation. I have participated in their Trust and Hope program, which is a Thanksgiving dinner delivery. We do that on the Wednesday before. It's very rewarding. Sometimes there are families, parents who have cancer and they have a large family and mom's not up to cooking. Sometimes there are single people who are all by themselves and we're going to open a can of soup or go to a fast food restaurant. And this way they get a real true Thanksgiving dinner, pumpkin pie, the turkey, the dressing, everything. And it's a wonderful program. It's very heartwarming and it gives you perspective on your own life that you're surrounded, if you're lucky enough to be surrounded by family and friends on Thanksgiving. So that's a program we participated in. As you can tell, I'm a huge fan of Illinois CancerCare and Illinois CancerCare Foundation. Although I'm uncertain the direction my cancer journey will take me moving forward, I knew I could not travel without the help of my family and friends. The Illinois CancerCare have been so supportive of Tim and me. I'm also grateful to have having co-chaired tonight's event with my friend, Terri Baldi, my guardian angel, my clone, basically. And also again, just extremely grateful to Dr. Lee Lindquister. She has been with us every step of the way, 5.5 years, trying different things. You know, excellent, just excellent care. I couldn't believe it. And this event is for a wonderful cause, to support cancer journeys that you or a loved one or either have or will experience at some point in your lives. We hope you're enjoying the evening. Thank you very much, and especially thank you to my husband, Tim. I couldn't have done this without you. Thank you.